Thank you for watching SHEM Ministries. Souls honoring Elohim's mandate. And now for today's message.
Well, hello. Welcome. Maybe a late broadcast, but you are with us tonight for a SHEM 2 Spiritual, Healthy, Enlightening Mandate Ministry broadcast from Dr. Anna Shaw Devlin. Yes, a mouthful of information that I have for you tonight. And for those of you who this may be a little too late or, during your wind down time, please, listen to us at a later time that may be convenient, because we want to talk about something called anaphylaxis. Yes, I want to talk to each and every one of you about something that unfortunately many people may encounter during the summer months, because usually if they are allergic to something, it may be ants and bees and wasps and things such as that. They may expose themselves to things that, normally people don't encounter in the winter months. So this is, to me, the perfect time to talk about anaphylaxis. And before we get deep into the conversation, let's have a word of prayer, asking that the Lord will allow us to make it plain, and that the information tonight will be easily disseminated throughout the viewers, those who either know someone that has had a reaction, that, mild reaction, that they need to allow a red flag to go up, because we never know when that reaction may become anaphylactic. Okay? So even though you have potentially maybe, every time I eat blueberries or strawberries, I don't have a bad reaction, but, I just get a little itch around my mouth, this, that, and the other. But you never know when your body, your immune system may say, you know what? I am getting ready to have a mast cell reaction. What am I talking about? That is the basics of anaphylaxis versus a little allergy, little histamine, like runny nose, rhinorrhea thing, right? Anaphylaxis is life-threatening, potentially death will pursue. So please take the time and listen. Lord, we thank you and we praise you and we glorify you for this information, that it will be a blessing to others. All right. So let's start out. I want to start out with just telling you what is anaphylaxis. And I am going to just go through some slides. And I try to take my time and kind of put them in order to make it a little easier to present. So please bear with me. But, and our information, you all know, it's evidence-based information. I acquire it from reputable sources. Internet does a really good job helping, and it gives us the Cleveland Clinic, the Mayo Clinic, National Health, just different sources that are reputable. So anaphylaxis is a severe, get it? Severe, life-threatening allergic reaction. So, we can have a reaction. For example, you get, not a bee sting, but a mosquito. Okay. You get a mosquito bite, and many people don't, a lot of people get mosquito bites and you just itch, right? And then you get a little swelling and you say, oh, I'm having a reaction. My skin, it's red, itchy, blah, blah, blah. Put a little something on it, topical maybe, and that's that. Well, anaphylactic reaction is a reaction where, and we're going to go through the different things. The severity is, when I say severity, I'm saying severe enough that if you do not intervene and intervene quickly, you can die. Okay. And it's life-threatening. It's a reaction that requires immediate medical attention. Like, well, let me just sit down a minute, I'll be okay. No, 911, okay? And so needs to be called. So it's worth you knowing what anaphylaxis is versus I'm just having a simple reaction. This is not simple. The symptoms typically appear within seconds or minutes of exposure, not a delayed response because you were bit by a mosquito and you scratched it or you rubbed it and then it started to swell. No, I'm saying to you that you don't have to do nothing to make it spread or itch or whatever. You don't even have to touch it. It appears so quickly to an exposure to an allergen. Anything that your body says, you don't belong here, I don't like you, that's an allergen. And it can affect multiple parts of your body. Common warning signs of anaphylaxis includes, number one, and it doesn't have to happen in this order, okay? And I guess I'm trying so hard because I want to make sure that I explain to you why it is so potentially life-threatening and why people end up dying from anaphylactic reactions because they don't take it serious enough. So whenever the skin reaction, many people start out with a skin reaction. They get hives or whelps, widespread redness, itching, and swelling, usually of the face, lips, or tongue. And usually that's what we call angioedema, is when the tongue is like 2-3 times the size, like all of a sudden, tongue swells up, lips swell, and you are having difficulty swallowing, drooling, and breathing. Usually the wheezing and the stridor is a late sign. Some people start with just, like I said, the itching around the lips. And then all of a sudden you're like, oh my God, my lip is 2-3 times its size. Well, think about when you go to the dentist, and have you ever gone and they give you some type of Novocaine, and you feel your lip and you're like, I can bite my lip, and sometimes you look in the mirror and you're like, oh, my lip is swole. Well, an anaphylactic skin reaction, it's not unilateral to like the lower lip, the right side of your mouth. It is the entire lip, not just the lower, but the upper and bottom. So that is the difference between anaphylaxis in regards to skin. It's the whole entire face, lips, or tongue, not just one-sided, if that makes sense. Now, breathing difficulties. And it, like I said, it doesn't have to go in this order. Throat tightness, wheezing. Some people, something ain't right. Okay. And I'm not talking postnasal drip. I'm talking your throat is getting tight, like something swelling in there. The wheezing, and not from asthma, and the thing that makes this kind of difficult is because some people do have asthma, and then there are people who are asthmatic that may have an anaphylactic reaction. Noisy breathing, and that is, we say noisy, but many times it's a whistle-like, and you realize, oh my gosh, what is that? That sounds like someone blowing a whistle. But that is actually the airway closing up. Shortness of breath, or a persistent cough. And there's different degrees of this. So look, you know how they say an ounce of prevention is better than a pound of cure. I'm telling you, it's better to be safe than sorry. Call 911. All right. Heart, cardiovascular symptoms. Anything cardiovascular is blood pressure, heart, okay? A rapid or weak pulse. It can go either way. Your heart could either be pounding, you can have palpitations, beating real fast, or your pulse may get very weak. Dizziness, lightheadedness, or feeling faint. Now, of course, these symptoms can happen with other things, but normally anaphylaxis, it is a combination of many of these things at once. Quickly, onset. The onset is quick. That is how you know the difference, okay? Gastrointestinal issues, nausea, vomiting, diarrhea, or severe stomach cramps. Some of these GI symptoms may be a late sign after when we talk about the mast cells, the late sign of these mast cells in your GI tract. So we're going to get to that. But I want you to know that the nausea and vomiting may not come first. They may be secondary. Other signs, sudden feeling of intense anxiety or impending doom. People will actually say, I feel like I'm going to die, right? And so usually when I get a call about a patient having a reaction, I go through many of these questions at once. I'll ask the nurse, any swelling, any shortness of breath, are they drooling, is their tongue big, all of those things at one time. So If you or someone else is experiencing these symptoms, call your local emergency number. And the other thing I want you to know, it also depends on where you live. Do not play around if you live down a long dirt road, or if the road that you live on is a mile from the main highway, okay? Please, please take things like that in consideration. And if you know someone who's high risk, and we're going to go through risk factors, please advise them, don't play around. Overview in regards to anaphylaxis. Like I said, it is very severe, potentially life-threatening. Can occur, and some of this information is repetitive, but I'm going to read it to you because it may say something that we may have missed. And also, the more you hear something, the more it makes sense to you and you will remember it. Minutes, seconds, okay? And examples of people who really, really have severe reactions. A lot of people are allergic to peanuts. That is a very common, and bee stings. These are two very common things that people do have anaphylactic reactions to. It does cause the immune system to release a flood of chemicals that can cause you to go into shock. And that is why the blood pressure drops suddenly and the airway narrows, blocking breathing. And then we're going to talk a little bit more about that. And the treatment we're going to talk about, and most people know about epinephrine, adrenaline, right? And having an injection of epinephrine, and anyone who needs epinephrine injection needs to go to the emergency room. Do not let them tell you, well, I took my EpiPen and I'm fine. No, there is something called a biphasic reaction, a repeat potential occurrence, that one pen may not be enough, okay? It may suppress it, but not get rid of it, and you do not want to take that chance. So anyone who has had an anaphylactic reaction, just because they have an EpiPen, do not let them talk you out of going to the emergency room. Now, they may not necessarily, depends on how far they live from the ER. Someone may be able to drive them, but definitely not, they may not need EMS to come, as long as they're close to the emergency room and can get there within a matter of a couple of minutes or so, okay? And if push come to shove, you're taking them to the emergency room and they start to have another reaction, go ahead and call 911 on your mobile device, okay? Immediate treatment is required. Why is this so severe? Let's go into this here. I need you to understand, here's a picture, diagram of how anaphylaxis affects the body. And these are just a few things, right? The face and tongue swelling, trouble breathing, nausea, vomiting, rash or hives, flushed or pale skin, weak or rapid pulse, wheezing, throat tightness, and nasal congestion. And everyone's different. And each time you have a reaction, your body may respond differently. People may say, oh, I'll be okay because all I ever get is a rash or hives. You don't never know how things may progress. Some of the symptoms, we've already gone through these. I'm not going to rehash them. just to show you, right, that some people have a delayed response. Some people may not have a response within minutes of exposure, but they can have a response a half hour or longer after exposure. You never know. You never know. In rare cases, anaphylaxis may be delayed for hours. Signs and symptoms, we talked about the itching, the flushed, pale skin, low blood pressure, constriction of the airway, the tongue and throat. We talked about that. Everything here we talked about. The main thing that I wanted to bring out in this slide was the fact that there are some people who may have a reaction, or let me say this, they may have a little itchy whatever and then say, oh, I'm fine now. I took Benadryl. I'm trying not to jump ahead of myself, but there are people who may say, I'm okay now. All I need to do is just take a little Benadryl and I'm fine. Guess what? Benadryl only treats a certain part of the allergic reaction in regards to histamines. That same person could hours later end up having anaphylaxis. And that is the reason why it is so imperative that we have this discussion, especially this time of year when all the bees are pollinating and this, that, and the other, and the ant pals, and everybody's trying to do their business during the spring of the year to prepare for the winter. Okay? So we cannot take certain things for granted. Be prepared. Those are some symptoms. Now let's talk about causes. So the immune system, as I said, produces antibodies that defend against a foreign substance. That is what we call antigens. Okay? This is good because we want the foreign substance that could be potentially harmful, such as a certain bacteria or virus, to not be able to overwhelm our body and take over, right? So you want your immune system to fight back. But some people, their immune system is what is overactive, and it may overact to these substances that don't normally cause an allergic reaction. So, allergy symptoms, they aren't usually life-threatening, but a severe allergic reaction can lead to anaphylaxis. And it's almost, you never know when a reaction may turn into anaphylaxis. However, many times, and please don't think that just because it may happen once, that it usually escalates. However, you never know when you may escalate. You know how they say don't pass go, or go, wait a minute, I forgot the saying or how they do it. Like, just keep, it'll keep escalating and you don't have to go through all the steps and stages. It can happen at any given time. Okay. So you don't have to go from mild, moderate to severe. You can go from mild straight to severe. Okay. That's basically what I want you to understand. Even if you or your child has had only a mild, okay, now they're saying it, and I'm sorry, I should have kept reading. I just kind of got off on my own little whatever. Even though your child has only had a mild anaphylactic reaction in the past, there's a risk of more severe anaphylaxis after another exposure to the allergy causing substance. The most common anaphylaxis triggers in children are food allergies, such as peanuts and tree nuts, fish, shellfish, wheat, soy, sesame, and milk. Besides allergy to peanuts, nuts, fish, sesame, and shellfish, anaphylaxis triggers in adults include certain medications, including antibiotics, aspirin, and other pain relievers available without a prescription, and the IV contrast used in some imaging tests. Stings, from bees, yellow jackets, wasps, hornets, and fire ants also, as well as latex. Now, one thing there's a couple of points I want to make here. All right. For example, my son, and he's not, and I don't know, you don't see bananas listed here, and I don't know if it's the actual banana skin itself or the banana or chemicals that could have been used with the banana, okay? Like pesticides or something that could, I don't know, right? But from the first time that he started itching around his mouth and everything, we stopped him, and I think it was the itching around the mouth and something with the tongue is why we stopped him from eating bananas, because I knew that the next time he would eat a banana, he could have had an anaphylactic reaction. But in hindsight, and the reason I'm taking the time to say this is it may not have been the banana, but what was used in the chemicals used on that banana. I don't know, right? And that is something that our body gets desensitized to. But in hindsight, if you don't know, just leave it alone, okay? It's not worth the risk versus the benefit is not worth it. And so we try to avoid these things. The other thing I was going to say to you is about penicillin. So many people talk about having a penicillin allergy as children. These same people are now adults. Well, guess what? What they used in making penicillin many years ago, they don't use anymore. So we've now found out that it was what was the additive in the penicillin agent versus actual penicillin. And so people now are able to take derivatives of penicillin, like cephalosporin antibiotics, that used to be allergic or had an allergic reaction to penicillin as a child, okay? And then remember too, when it comes down to antibiotics, there's the first generation, second generation, and third generation. The farther out generation you go, usually the potential for reaction is less. So what am I saying? I'm saying a person who may have been allergic to penicillin as a child may be able to tolerate a third generation cephalosporin antibiotic such as Rocephin without a reaction. And the reason I definitely bring that out is because this is a very, 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 very common drug that is a broad spectrum antibiotic that kills a lot of gram-negative, gram-positive bugs. Excellent drug that people try that have had an allergy to penicillin think that they cannot take. But in actuality, it's a good drug and can be used. I know that was a mouthful for me just to bring that one point out, but I just needed to hopefully say it where it would be beneficial to you. Now, although it's not common, some people develop anaphylaxis from aerobic exercise, okay, such as jogging or even less intense physical activity, such as walking. It is not common, but believe it or not, it can happen. Eating certain foods before exercise or exercising when the weather is hot, cold, or humid also have been linked to anaphylaxis in some people. I'm telling you. So I just don't want a person to think, oh, I'm okay, and actually you're having an anaphylactic reaction and you need immediate medical care. If you do not know what triggers an allergy attack, certain tests, of course, can help identify the allergen. And many times this requires going to see an allergist, and they have testing, and they're looking for antibodies that your body makes. IgE is one of them that they may test you for. So the cause of anaphylaxis is not identified, right? Sometimes you may never know what caused your anaphylactic reaction. And that's called idiopathic anaphylaxis, where they just cannot figure it out. Unfortunately, it happens, but thank God it's rare. Most of the time, they're pretty much can pinpoint the source. So, risk factors. There aren't many known risk factors for anaphylaxis, but some things that may increase the risk include previous anaphylaxis. If you've had anaphylaxis once, your risk of having this serious reaction increases. And it may not necessarily be to the same antigen. It could be something else. I mean, not antigen, but allergen, okay? Antigen is what your body produces afterwards, after you've had a reaction to something. So some people are just hypersensitive. There are some people who react to just about everything. They can't eat peanuts. They can't eat strawberries. Some people just have a very overactive immune system, and they kind of link together. Future reactions might be more severe than the first one. Allergies or asthma. Many people who have asthma, because asthma is an allergic reaction. It is, okay? People who have either condition are at increased risk of having anaphylaxis. Yep. Certain other conditions. These include heart disease and an irregular accumulation of a certain type of white blood cell called mastocytosis. Those are mast cells. And we're going to get into mast cells. I'm getting ready to talk to you. We're going to talk about mast cells. Complications. An anaphylactic reaction can be life-threatening. It can stop your breathing or your heartbeat. So that's severe, okay? We're going to go through prevention and stuff, and then we're going to definitely talk about the mast cell reaction, because that is is what you really got to understand why anaphylaxis occurs. So in prevention, the best way to prevent anaphylaxis is stay away from the substance that causes this reaction. Avoid it. Don't eat it. Don't even, and it's so severe in some people, if you look at the labels on food, it'll say this was produced in a same company or the same equipment that produced whatever, peanuts or something. It could, there are people like granola, even though the granola bar may not have peanuts in it, but the same granola, the company may also have nuts, and they tell you avoid, the little warning label on the pack. So, or it may say, if you have an egg allergy, it may say that this food or whatever is also produced in the same whatever that has eggs, or the meat. This was cut on the same device or machinery that also cuts meat or something. So, but they're putting these warning labels on things now. You have to learn to read the fine print. And I'm thankful that most of the time they make them bold now, bold letters. It'll say, this also contains so-and-so. And me personally, I avoid dairy, and I'm very thankful where it'll say contains milk. And a lot of people don't understand that soy is also a form of dairy. And so, if you don't know, I'm just going to tell you, it's not an easy thing. And the more and that's why we have to go through these things and take the time and try to learn. But prevention, wear a medical alert necklace or a bracelet to indicate that you have an allergy to something specific. Keep an emergency kit with prescribed medications available, such as the EpiPen. We're going to go into that. And the Epi auto-injector, I'm going to show you that. Be sure to alert all your providers. Make sure everybody knows that you're allergic to certain things. And if you're allergic to stinging insects, use caution around them. Wear long sleeve shirts and pants. Don't walk barefoot on grass. Don't wear bright colors because that attracts the bees. Don't wear perfumes and colognes or scented lotions. These are things that attract insects. And I myself, unfortunately, was getting stung, or not stung, but bit by, I didn't know that these little flying gnats, I didn't know gnats could bite you. And I just kept getting bit, like, oh my gosh, what is biting me? And there weren't mosquitoes, and come to find out that they were these little flying gnats that kept biting me. And, because, I like bananas, and I would probably have a banana sitting in my office. And anyway, long story short, I was getting bit. And so I purchased one of those Zevo UV lights to catch the gnats. And then I was, that worked for a while. And then I went through a period where I started getting bit again. Come to find out, I was wearing sweet smelling lotion, and I was like, dang, I can't even do that anymore. I was getting bit. So I'm always transparent and tell you things that I personally encounter, hoping that it will help you. All right. So if you have food allergies, be careful. Like I just said, please make sure you read the labels of all the foods you buy and eat. Okay, manufacturing processes. So it's telling you all the stuff that I just told you about. The manufacturing process can change. Periodically recheck the labels of food you commonly eat. That's exactly right. Yeah. Don't just grab it and eat it and don't read. Things change, especially, let me tell you how. One thing. If you routinely purchase something and they change the label or the color of the packaging or whatever, be careful. Normally, when they make a change in the packaging, it's because they did something to it differently. They changed something about it. Okay? Let that be a red flag to you. Get it and read the label again. Sometimes they'll put on there new, improved, or something. Pay attention to that. It means something. Even if you've never had a problem eating something before, anytime you see new, please read. Take the time and read it. And I'm not just talking about food either. I'm talking about hand cream, soap, anything that you use, any water, flavored water, anything new. Read it, okay? And be prepared. Even if you're careful, at some point, you may be exposed to something and end up being allergic to it. I listened to a lecture last week from someone that was talking about eating Papa John's pizza. Said they've always had Papa John's pizza. This one particular time, ate a slice of their favorite Papa John's pizza and had an allergic reaction, an anaphylactic reaction. The first time they went straight to severe. They didn't have a mild, they didn't have moderate, they went straight to severe. It happens. The bottom line is, do not take it for granted. Call EMS. I'm not going to go through diagnoses because most of the time, once you have that reaction, you're going to go to the emergency room and they're going to tell you, okay, to avoid this, easily diagnose you based on your symptomology. Treatment, epinephrine, maybe oxygen, IV fluid. They may have you take a beta agonist medication such as albuterol, like a bronchodilator. So if you can't breathe, you're short of breath, and your airway closing up, yeah, they may give you a beta agonist, a medication to open up and dilate your airway, right? All of this stuff may happen. But like I said, call 911 and go and get medical treatment. We're going to talk about using an auto-injector for epinephrine. And we're going to talk about that next. I think, you know what? I do apologize. This was a later slide. I should have gone to this next, so we could talk about symptoms of mast cell disease. Okay? Now, mast cells, these are actually the culprit in mediator release of when this is what causes the anaphylaxis, the mast cells. And this is just showing you how the skeleton, cardiovascular, all the symptoms that we showed you earlier about the airway closing up, all this things that happen in anaphylaxis, right? But let's get more specific and talk about mast cell activation syndrome. Okay. So understand that the mast cell is what is driving and causing anaphylaxis. The system is activated by the mast cells. This anaphylaxis is a mast cell activation. It is an immune condition where the mast cells become overactive. So what am I saying to you? The culprit behind anaphylactic reactions are mast cells. If you do not remember anything else, I want you to know an anaphylactic reaction can occur quickly, suddenly, or it can be delayed. That mast cells are the culprit, and the treatment involves epinephrine. It can involve you needing oxygen, IV fluid to flush these mast cells out of your body. Okay? Okay. And you may require another dose of epinephrine. So you have to go to an emergency room type environment, and they need to watch you at least 6 to 8 hours. If you don't remember anything else, remember the severity can happen just like that. It can be delayed. You got to seek treatment. And this is the culprit and the reason being, okay? This reaction starts with histamine release in your body, okay? Mast cells become overactive frequently and inappropriately releasing chemical mediators like histamine in the body, but that's not all they do. This results in an unpredictable recurrent symptoms that mimic a severe allergic reaction or anaphylaxis across multiple organ systems. You do not know if this is going to actually progress to anaphylaxis, but this is what starts the cycle, starts the reaction, the chain reaction. So, because mast cells are found throughout the body, they can affect nearly every organ system. The skin we talked about, the GI, the heart, the respiratory, neurological, brain fog, fatigue, chronic pain, and anxiety. All of this is stimulated through the mast cell reaction. It does begin with histamines, but it can progress. While this mast cell is often called idiopathic, occurring without a known cause, flares can be set off by a variety of everyday stimuli, including the foods, the drinks, temperature changes, stress, all kind of stuff, scents, perfumes, you name it, okay? And diagnosis is made by specialists like allergists or immunologists, okay? Lab tests can be done to confirm elevated mast cell mediators, most commonly serum tryptase during a flare, okay? There's so much involved that can be involved, but I want to move on and talk about management and treatment. And then I want to talk about epinephrine. I want to end by talking about epinephrine because I want you to know what epinephrine can do. Know that you need to have at least 2 doses available. And so let's keep going. Management and treatment. Treatment focus on avoiding the triggers, blocking the effects of the chemical mast cell release, which multiple, all of these things listed are the things necessary to block this mast cell release in the body, your immune system, stabilizing them. Number one, H1 and H2 antihistamines. These things only treat the histamine. Anaphylaxis is multiple mast cell. It's a cascade of things that happens in your body. So the histamines come first, right? The itching, the whelps, those kind of things. So H1 antihistamine is Benadryl. H2 antihistamines are Zyrtec, Claritin, those things. Cetirizine, loratadine, famotidine. These are the H2 blockers. H2 blockers work well. Actually, the cetirizine has been known, Zyrtec, to be a better H2 blocker in regards to histamine reaction. Okay, I'm just telling you, head-to-head, test by test, okay? Benadryl works okay. It's an older drug, and it most people have Benadryl, but it's sedating. And then, like I said, they found that the H2 blockers work better, especially the cetirizine. Now, mast cell stabilizers. These are things such as cromolyn sodium or ketotifen to prevent the release of mast cell chemicals. Leukotriene inhibitors such as montelukast to assist with breathing and inflammation. And that drug used to be called Singulair. And it does help. So, for example, myself, I have allergies, and I take the leukotriene inhibitor, I take montelukast, and I may take Zyrtec or Claritin or whatever, okay? I take the two. But push come to shove, if I were to have a reaction, I know to call 911 because it may be where I may need a nebulizer. I do have albuterol, which would be the beta 1 that we talked about, okay? But if push come to shove, if they didn't work, 911, here we come, okay? And this may require EpiPen use if the airway closure, and that's why you do call 911, so that they have that medication readily available on their truck. All right, so now I do want to go to, let me see where I want to go next. I want to go ahead, as our time is dwindling, and let's go ahead and focus on the epinephrine, right? Because you already know Zyrtec, those things, right? Benadryl, but let's talk about epinephrine. Epinephrine is also known as adrenaline. Now, adrenaline is a hormone produced by our adrenal glands in our body. It's our fight or flight. It drives your body's fight or flight response. And that's why when you're having an anaphylactic reaction, sometimes, you get the fast heart rate, or, you get the low heart rate. But when you first, a person gets epinephrine, their heart rate will go up. And so if they've never had epinephrine before, you warn them and let them know. And that's something that when they're prescribed epinephrine or EpiPen, they should be told and given that information in advance. But it's transient. It don't last forever, right? But it does what it's supposed to do. So it increases the heart rate, elevates the blood pressure, and it opens the airway. Okay? And it is an injectable medication that is life-threatening. And how does it work? Well, let's talk about the mechanism of action of the drug. And it has an auto-injector, and I'm going to show you pictures of the EpiPen. Acts quickly on your body's adrenergic receptors to reverse the life-threatening symptoms of anaphylaxis. It constricts the blood vessels. This is why the blood pressure goes up. It raises a dangerously low blood pressure and prevents heart collapse. Relaxing the airways opens the lungs to make breathing easier. It reduces swelling, decreasing the swelling in the throat, the face, and lips. So you may have a transient side effect of, you give them the adrenaline, the epinephrine, and immediately they may say, oh, my chest is hurting. Oh, my blood pressure went, oh, my head is hurting. But look, it's not going to last long, okay? It'll last long enough to do what it needs to do. Natural body function. So day-to-day life, your adrenal glands release small amounts of epinephrine, not the dose that is being injected. And during stressful, exciting, or frightening situations, the body releases a large surge, which causes the heart rate to go up, dilated pupils, so that you can see better, right? Like, oh my God, your eyes get big, and a boost of energy as the body breaks down stored glycogen into glucose for the muscles. To give you that energy, you need to run, right? Dog gets behind you, or you get scared, and the muscles get what they need. They get the glucose they need, okay? For energy, remember that. You got to have glucose for energy. Stored up energy, stored up glucose is glycogen. All right. So, epinephrine is also used in severe asthma attacks, cardiac arrest, and septic shock. I'm not going to go into details of that, but I just wanted you to know that epinephrine is used in a cardiac arrest. The heart stops, right? It stimulates the heart and improves blood flow during CPR. Epi is given. Epi, you give it every 3 to 5 minutes. How long has it been since you had? Give some more. 5 minutes. Give some more. 3 to 5 minutes doing CPR. And that is the other reason that if you have an anaphylactic reaction, and some people require more than one injection. Okay? Please know that, and we're going to get to that. So now, let me see. Talking about the EpiPen. This slide here tells you how to use the auto-injector. I'm not going to go through that with you because I'm going to show you how. I've got a slide that shows you how to use it. Okay? But it shows you the EpiPen. And here, like I told you about the side effects, and common side effect, like I told you, was fast or irregular heartbeat, sweating, nausea, dizziness, weakness, headache, and nervousness, because these are the things that happen with vasoconstriction, right? The heart rate goes up, the blood vessels constrict, the blood pressure goes up. but it saved your life. There's a difference. It makes a big difference. But people need to know, if they've never had a shot of epinephrine or used their EpiPen. And I know I've seen some movies on TV where the person injected the EpiPen and you see them gasp or respond in a certain way. Well, that is the reason. Okay? And the dose is different depending on if you're an adult or a child. Children have a certain dose as well, or a weight-based dose. Okay? EpiPen comes in an auto-injector. Most EpiPens are 0.3 milligrams for the adult, and the EpiPen Junior for children is 0.15 milligrams. Okay, and they and how it works, it ejected. I'll show you that in just a minute. This is just some information. I was just trying to see, was there anything specific that I wanted to tell you about this? Number one, always carry 2 EpiPens. Okay? 2. And I was listening to a provider in a lecture saying that especially people who live in a rural area and you don't have time to get to a drugstore, so you only have 1 EpiPen. If you use one and you didn't need another, get a refill. Do not rely on just having 1 EpiPen. Okay? All right. Trying to see, was there anything else there? Nothing else really significant. I wanted you to know that Viatris, Viatris, is one of the company that manufactures the name brand EpiPen. Okay? But remember, Epi is an adrenaline, and there are some generics. The reason I put this photo in here is because I need you to know that you ain't got to pull your pants down and inject no EpiPen. You inject it through your clothes, okay? I don't want you to think that, no. If a person needs Epi, they need the Epi. And here is... I told you I was going to show you how the auto injector works, right? 1, 2, 3, 4. Click. Bam. Slap it in. Hit the plunger, and there you go. You got it. All right. This is what the auto injector looks like. You pop the cap off, and so that you can inject it. 2-pack EpiPen. Now, it goes all the way in. The needle's not that long. So the red striae at the bottom is the muscle. The yellow is the fat, subcutaneous tissue, and the top layer is your skin. Do not get it dead into the muscle. And the best place you want to inject it is in the thigh, because it is a large muscle. And the larger the muscle, the more blood supply. Because if you only have a couple of minutes to save a life, you want it injected into a large muscle so that the medication can be rapidly distributed and do what it needs to do. Okay? Thigh muscle. All right? And if they don't have, well, I pray that there is some thigh muscle. Should be enough. It's usually, unfortunately, the thigh, even if they're thin, they probably got more thigh than anything else. I would hate to see the biceps on the arm or the deltoid. You don't do it there. Okay? It's the thigh. Even children have a little fanny pack when necessary. It just depends. They have a fanny pack to carry their EpiPens. That's how severe it is. And that's how you got to have it readily available. And here's another picture of the 2-pack. Okay? So, I hope and pray that our discussion tonight about anaphylaxis is a blessing to somebody. You gotta know what can happen at any given time. A person who is high risk for allergies or anaphylaxis. And high risk for an anaphylactic reaction is someone who easily reacts to anything. Now, there are people who get a mosquito bite, and that mosquito bite turns into this huge, big red ball. Guess what? That's somebody I would consider high risk. Potential for an anaphylactic reaction. I'm not saying that they're going to have one, right? But that person is high risk. There are people who have hives and palpitations and all exercise-induced responses. They're hypersensitive. They, at any given time, can have anaphylaxis. One thing I did not, listen, this lecture could be extensively long. I tried really hard to present it without getting so complex. I didn't talk about the EpiPen, the Neffy, right? Which is a inhaler that nasal aspirator, where epinephrine is intranasally snorted like like Flonase or something, right? It goes into the nose and it works well. The way that the epinephrine is formulated, it rapidly absorbs into the nasal cavity. Okay. Is it cheap? No. I didn't even discuss costs, because I'm going to say this. Unfortunately, I hate to say it, but a person who has an anaphylactic reaction, if they died, it sounds morbid, but think about the cost of their funeral. Even if you did not bury them and cremated them, unfortunately, that's a cost too. I'd rather have them alive and with me. So we paid a price. It really, not too long ago, they talked about how expensive it was to get epinephrine. And I think that is just an atrocity, that people who need epinephrine should not have to go through what they have to go through to have those pens. Just like insulin costs should not cost what it costs for some people, okay? Our healthcare system is broken. My job is to educate you. The more I educate you, the more you know. And when we vote and elect people, know who you're voting for. Know what they represent, what they value. And just because someone says they care about these things, you need to look at their voting record and see how they voted. Okay? All right. This is Dr. Anna Shaw Devlin, family nurse practitioner. This is our SHEM 2 night. I'm sorry. I feel like I was kind of the wrong time. But I, kind of off a little bit because it's just not my norm. But I do pray that something I have said has been a blessing to you. I did attend a educational dinner tonight before we presented. So guess what? More to come on some other topics. I have to take the time to learn so that I can teach you. Remember that, okay? All right. To God be the glory. God bless each and every one. And we pray that we will see you on Sunday. And do not forget Dr. Devlin, her husband, Dr. Shine, pastor of SHEM Ministries, will be with us in the morning at 6 a.m. for our prayer service, prayer line. All right. To God be the glory. God bless and have a restful night's sleep.